My name is Carla Kendrick. I'm a second semester student here at Jeff State in the nursing program. And I chose Jeff State because I wanted to go somewhere where I would be supported through the program and also somewhere that would equip me so when I got in the real world I would be prepared so that I could be the best nurse that I could be.
Hey, I'm Evan Carr. This is my second year in the nursing program. I chose Jeff State personally because my sister had leukemia back in 2013. And her nurses really just got me where I felt the calling to go be a nurse. So this is just where I ended up.
I chose Jefferson State's nursing program because it worked best for my family. I have 3 kids and need to work. And so the night and weekend program really fit best for what we needed for my family.
For studying when it comes to the nursing program, the number one tip that I have is always start early. Starting early is the key because it decreases the time that you actually have to spend leading up to the test, and you can put more time into the end material that you learn. And then I will also say get a study partner. Find someone that's reliable with taking notes that could help you if you're not there, if you have an emergency or something. And just find someone else that you can link up with that can help you just as well as you can help them. So that would be my best study tips.
My studying tip would be to find some of your people and get with that group and quiz each other over and over again. We will take parts of the chapter, outline it, and then meet up and say, tell me everything you know about this subject. And in doing so, your friends can sort of help you fill in blanks, help you understand things that you didn't maybe pick up in class or in lecture, and then take those parts and pieces and put it together. And really, it's best if you start this as the information is presented. So it's an ongoing process of helping each other out. I found that working together has been much easier for me than trying to study by myself and shove everything into my head alone.
The way that I take notes in class really depends on the instructor and how they teach, but for the most part, I try to key in on those really important details that they spend a lot of time on and make sure I write those down, and also try to record the lecture so that I can go back and listen to it, which really helps a lot.
All right, so taking notes in class, I definitely recommend going and printing off any PowerPoint that the teacher may have. Use the school library, print it off in the computer lab, but definitely print off those PowerPoints. And if you're good at listening, try to really pay attention in class and stay awake.
In class, most teachers will give us a copy of their PowerPoints, and so I try to go through their PowerPoint and any information that they augment on what's not necessarily on the PowerPoint slide. I will write that on the side or underneath the slide, and then I have a highlighter. Anything that is reiterated or emphasized, I highlight that, underline it, maybe do a star or bullet point, and we'll say know this for the test, or go back and reread this information. So I just try to pick up on what the teacher has given us as important information and make those sort of my main topics that I'm going to focus on. And then as I'm reading or going back and studying or working with my group, I make sure that we focus in and hone in on those key points.
The way that I manage my time during nursing school is basically just taking the time out, knowing in advance how much time I need to study. And also, I do have a husband and I do have a 3-year-old, so that takes a lot of my time. I'm not working, but they also understand the process that I have to go through in order to be successful. So they also understand that when I'm sitting down at my desk, that's my time. So they don't interrupt me, which is really good. So I would say just knowing how much time you have to spend and then just doing it, really.
All right, so me personally, on managing time, I actually quit my job when I started nursing school. I tried to kind of work and do school at the same time, so it just gets really overwhelming. Definitely study as much as you can. Like I said, start early and just stay with it.
Time management is hard because when you're in nursing school and have kids and a job, there's not enough time in the day. So having a day planner for me and writing out every single day, like, this is what I have to accomplish this day, or these are my, today I need to study this chapter, I have to go to this meeting or this appointment, and just looking at it day by day as opposed to this huge chunk of things that you have to accomplish that are not manageable. That has just helped me, keep my life organized and making sure I have enough time for school, work, family, everything that we have going on.
All right, so critical thinking is really important. Basically, you're going to walk in a room and you're going to see a patient, and it's not going to be how you saw it in the book. It's not going to be how you saw it in class. And that critical thinking is really going to be very powerful in how you're going to take care of that patient.
Critical thinking is very important in the nursing process because that's what makes you a great nurse. So you have to be able to take those things and those concepts that you learn in the textbook and be able to apply it in the clinical setting. And that's not an easy process. But if you go through the program and you listen to the advice of the teachers, then you can really learn to think critically. And that's going to help you in the long run because you have to have that basis where you can critically think in the situation and apply those things that you've learned in the past to a current situation. So,
critical thinking, I didn't really understand why it was such a big deal for nursing school until I got into the clinical environment. And then I would go to a patient and see that this was happening with their vital signs, or they sort of looked a little weird. And so you go back and sort of see what that patient was going through or what their health history was, and then you might start saying, like, hey, well, their blood pressure is going up and their heart rate is going up, but they had surgery today. Well, maybe it's because they need pain medicine, or maybe they're getting an infection. So critical thinking skills help you sort of understand what's happening with that patient, and it may not be really apparent in the beginning, and you might have questions, but if you don't use your critical thinking skills and start putting things together, then you might miss out something bad or something good that's happening in this patient's health.